Well, Branwen, welcome. It's very good to see you here today. And I know that you've been very determined that you shouldn't hide behind your parents, that you young people who have experienced the results of sodium valproate should be able to speak and speak for others. So I do welcome you here today. When you came to the previous oral hearing, you raised a number of concerns that adopted or foster children may be unaware of their medical histories. That was one of the concerns you raised. And arising out of that, that they may remain undiagnosed and unable to access appropriate support. And you also emphasise the difficulties in assessing appropriate medical care, educational and broader social support, in particular due to cuts to some regular services. So we understood that and took that on board. You also raised the whole issue about young carers, and a number of young people are carers to patients and indeed to their siblings, but this isn't often acknowledged. And you were very worried that these people don't receive any support that they should receive. And this is about counselling, respite care, mental health, and how that impacts on young carers. And then a number of key questions you raised with us, which were really interesting. And subject to all of that, we have listened to what you've said, but today is your opportunity to tell us what you have heard in the intervening 5 months since the first oral hearing, and anything you want to say to us that would help us with composing our recommendations, any further research you think we should be doing. We would welcome any thoughts you have, and perhaps we could start just by you saying who you are and why you're here.
Well, my name is Branwen Mann, and I represent young people who are affected by sodium valproate, and I do have fetal valproate syndrome as well. I'm here to be a voice for everyone who don't really have a voice who have fetal valproate syndrome. I've actually been given a job recently, which is quite a huge one, which is being a layperson on the Children's and Young People with Disabilities and Severe Complex Needs Guidelines Committee with the National Guideline Alliance, and to be honest it's pretty huge. I still can't believe it to this day, but yeah, I'm really looking forward to helping with the guidelines and changing them, and helping with the benefits and national health system and service and everything else, and I'm really looking forward to it. Yeah.
So has that been difficult, finding a job?
Yes, actually, yeah. It was a very long process with the guideline committee, because I don't think they had many people applying and stuff. But after about 3 or 4 months of me sending in the application, they finally gave me an interview. I spoke with them on the phone, and they said, we'll give you a call in about 2 or 3 weeks to let you know the results. And 2 days later, they phoned me back saying, you got it. I was like, oh, okay, great, thank you. But yeah, it's been really hard, but thankfully with the committee, they only meet up once every 10 weeks or something like that, and which is amazing because of the health with me and stuff, and I'm not really good with travelling. Yeah, I'm looking forward to it, to be honest. It's not happening until July, but still, yay!
So do you hear that from other people?
Yes, yeah. I hear about stories, well, I'm not, obviously when it comes to the guideline committee, I'm not allowed to speak to organisations or anything because of, policies and stuff. But I do speak with young children who are affected by fetal valproate syndrome, and I ask them how they would like me to change the guidelines, or to maybe help them in the future, or maybe their children in the future. And I've been hearing a couple of little things that I could probably improve. One of the main things is PIP and the system and stuff, because wow, I still can't believe the stories that I've been hearing about PIP. Basically.
So you've got some things there you'd like to read, yes.
Yeah, like I mentioned last time, I would like to acknowledge the group of children that did not survive. Since speaking last time, others have shared their stories with me. So many Valproate families are devastated by this experience. There were too many late miscarriages, neonatal deaths and stillbirths and early deaths related to Valproate. Again, I want to acknowledge my own dead brother and sister, Kavern and Chalessa. Before I begin, I just realised at the top of the page, I want to say a huge thank you to my mum, who has actually helped write this for me the past week, actually, because I've been doing a lot of babysitting and stuff, and she's just been a godsend to me. She's helped me write this up, so thank you, Mum. When a baby dies early, not everyone wishes to talk about it. The experience gets swept under the rug as if it never happened. These babies are a part of the story too. I'm acknowledging all the babies that did not make their first year. Conditions such as epilepsy, mental health disorders and even migraines can bring an element of stigma. I have been disgusted to learn of how some of our mothers are treated during pregnancy because of this. It is forgotten that they take medication that affects the mother during pregnancy. Other health problems can come to the forefront during pregnancy. These are clearly vulnerable women. It is understood that labour and the birth may be problematic, yet staff are not always prepared. I was horrified to hear some of the stories as to how mothers would not listen to when they expressed concerns regarding their babies. One baby spent a day in a special care unit. Before being taken to a mother, the baby would not feed properly. The staff from the special care unit showed her how to feed the baby. She was naturally distraught as she was made to feel she was unable to feed her child. She thought herself to be a terrible mother. Visitors expressed concerns about the baby, still no one looked at her child. 2 days later, her child was not breathing properly, still no one looked at her baby. Then, when bathing her baby as she prepared to take the little one home, a midwife stepped in. Her baby was rushed to the Harefield Hospital. The baby had 2 holes in the heart and needed an operation at 6 months old. I think it is disgusting that this sort of thing happens at all. One baby died because a doctor refused to believe that the mother was in labour because she was early. Because of this, she went through labour and gave birth with no support. Her baby died as it needed an incubator. Most of these mothers do not complain, as so many of these women have been put down most of their life. They are insecure and have learnt not to. There are hospitals that feared to be sued and close ranks. All women need to put things into place, the new mother in such circumstances. One mother was lucky. She approached a solicitor who by chance had been a midwife. The solicitor told the mother to focus upon special needs baby and dealt with everything. The hospital was not sued, as all the mother wanted was recognition and support for a baby's needs. There needs to be an independent body that is clearly advertised to help women in this situation. Something else I noticed in these stories was that those who underwent this type of experience were watched carefully by social services with regular visits. There were some that were forced to attend places that taught the mother how to care for her child. I know some of these mothers. This is perhaps correct for the situation for some, but there are others who are always there for their child. They give loving support and fight hard for their children's needs. I don't know how any mother might cope when she's under such scrutiny. Education. When I was in primary school, I had to be pulled out of class in the middle of the day to do exercises with my teaching assistant. She had to be trained to ensure she could do my exercises properly and safely. Today, that school has benefited. With a teaching assistant that has been trained in this way for free, the school has invested in further training. That school now welcomes children with medical conditions, some of which are disabled. It is set up as a place that can provide appropriate care and works closely with the local health community. This is not always the case. Organisations that independently support children with special education needs have told us policies are often in place that will provide the children appropriate support. Parents and carers are not always aware of these policies and are not informed by them. If they are aware of these policies, they often have to fight to ensure that they are put into place in a way that supports their child. Families with special needs children do not always have the time and energy to give what is needed to themselves to do this. Many parents and carers are not always aware of which organisations are best placed to support them. Education is one of these areas that you hear most complaints about. The process of assessing a child is not always appropriate to a child's needs. We have spoken to parents that they've been told by professionals that the money is not in place to give the necessary time to assess a child. This can have devastating consequences for the future of these children who do not access appropriate support. Bullying is another problem that I've heard a lot about. It is something that I've experienced myself. The best provision to improve this and raise our self-esteem is whereby the school has a base where special needs students can go to during the day. Any additional medical support can take place there without being obvious to other children. Additional support for schoolwork and socialising and safe space needed is so essential to our well-being. Schools that have a base find it easier to offer additional opportunities for the children. At my secondary school, we attended the National Children's Games at Stoke Mandeville every year. Two brilliant initiatives include prefects. A prefect oversees a part of the school, such as the junior playground. One child at the special education needs schools provided support for the younger students going to senior teachers if a child was having difficulties at school. The other is a mentor who may be given a named child who may have been identified as needing social support within the school. Mentors also provide an awareness of the resources within the school or help them to approach someone where they're finding things difficult. Inadequate resources are clearly why parents and carers and the children themselves have not been heard. This can mean that a child is not assessed properly. Inappropriate equipment is used instead of the recommended equipment due to costs. Equipment that might be used to support the learning at home is rarely supplied. The SEND system introduced in 2014 did not fix the old system, but have added a new set of problems. The evidence taken in by the Education Select Committee and a hearing witness from Ofsted and Quality Care Commission have and local government confirm that children with special education needs are being failed. It was found that many councils do not comply with the law and the supporting children with special education needs. Parents and children are not consulted regarding decisions and hurdles and placed in their way, making it more difficult to access resources. The money is not being properly used to ensure that we get resources that we need. Another thing that I'm going to talk about is homeschooling. Not surprisingly, a number of mothers have given up and turned away from the school education system and have decided to home educate. They have become frustrated as they watch their child decline because of a lack of necessary resources in place for their child in school. The authority has a duty to review a child statement or EHC plan annually. If your child has an education healthcare plan and a personal budget, they'll still be eligible for this. All children with the EHC plans can request a personal budget, as long as home education is specified on your child's EHC plan for educational provision. The child should get money. However, each local council has its own policy on this and often make it a difficult or impossible process. I have spoken to mums who fund home education out of their own pockets, which is actually quite common. The ability to home educate money is important as it can be used to purchase and manage services that will ensure that the child can access the resources needed to ensure the child has a good education. Some parents believe that their child cannot access the medical support, such as speech and language therapy, that they will be able to access if in a school. If your child requires special medical care, such as hearing tests, speech therapy, this should continue as the NHS service follow the child, not the school. The NHS may not refuse treatment to a home educated child on the grounds that the service is normally provided when they're in a school setting. I am concerned that there are home educated children that have fallen through this net and are not aware that the child can still access these resources. We need to ensure that the home educated children receive the financial support so that they ensure that they can access the resources that improve a child's education. Boarding schools are another alternative to the education system. It is easier to access funding for this, but it is not an easy process. It can be possible to find a school that supports a child's needs. A lot of research for this is needed. However, in many cases, a family's life is greatly improved. The time with the child is a joy. The stress in the home life is reduced. When a child has complex needs that are difficult to meet, sometimes it's the best option. I spoke about this last time. Sorry, give me a second. There you go. The importance of our families. Our families are important to us. Many of our siblings will also have a fetal Valproate syndrome. We live in diverse family units where we rely on our parents or carers to ensure our needs are met. Many of our families are also single parent families whereby where our mother is a sole carer. In some families, both mother and father are disabled. In some separate families, the father is still a strong parental figure, provided support for the mother. In my family, we function as one unit. When one of us is ill, it affects how we function as a unit and as an individual. I expect a lot of families have a similar system of coping. Those with fetal Valproate syndrome are often anxious or have depression, and we cannot always grasp what is happening around us, too easily panicking when something does not do as it should. Our family is our lifeline. Our well-being depends upon the well-being of our family unit. Their health, their stress levels, their mental health, the carer's assessment is not meeting our needs. Social prescribing, a brilliant initiative, has the ability to provide us with some areas of support. However, it leaves the family with areas of needs that are easily dismissed, and some form of support it already has in place. As we grow older, we watch the health of our parents and carers deteriorate. They will not always ask for help, as many no longer trust those professionals that oversee the welfare of the family group. My mother once tried to explain it all to me. She shared that different mums are likely to have been. She said that some mums are likely to have been ostracised at some point within their life. It is a very demeaning experience that leaves you totally disempowered. It is the experience that a person who has epilepsy, mental health problems, migraines and pain faces the world. All have invisible health problems that are disabling in their own way. The challenges are faced and not just related to health conditions, but also upon the effects of the medication upon them. They can cause a greater risk of sleepiness, difficulty with thinking clearly, reasoning skills or ability to remember and solve problems, coordinate their bodies and communicate effectively, even the weight gain. Much of their health problems are dismissed as a side effect of their medication and rarely explored. As individuals affected by anxiety, it is essential to our well-being that the health and well-being of our family is recognised and their needs addressed too. We need to be empowered in so many ways. I have imagined an epilepsy nurse sitting with me and my sister, answering our questions and explaining to us what we are seeing, and then giving us the tools that will help us care for her when she has a seizure. Even those that find it difficult to communicate with experiences emotion in these circumstances. This does not happen, and we are left disempowered and worried. Those with mothers affected by bipolar, migraines and neurological pain live with challenges that leave a child with similar fears. As our parents grow older, we wonder what will happen when they die. Who will care for us? Will they be competent to care for us? Will they even be able to assess our needs? Medicine safety. My life experience has ensured that I have a great interest in medicine safety. Myself, my mother and my grandmother have all had negative experiences regarding medical prescribing, which is surprisingly common in those with chronic health problems. Medicine is too easily used to counteract the side effects of other medicines, to the degree whereby some of the doctors prescribe medicine to counteract the medicine they have just been prescribed. Not all professionals use yellow card system to report side effects. For me, more importantly, are medicine-related patient safety incidences being reported on the National Patient Safety and Alerting Systems. It is the analysis of the National Reporting and Learning Systems that new risks are identified and communicated via the use of medicine safety alerts are carried out through the NHS England. We need a greater policies of how medicine is used and abused in this country. Medication overdoses and the practice of prescribing medicines and medicines that are contraindicated. One of my consultants introduced me to the postcode lottery system for the access of medication in the country. I asked one of my frustrated consultants to explain this to me when he found that yet again I was unable to access medications to help me cope with the chronic migraines. In the UK, formularies there have been decentralised. Each CCG has its own local formulary. In my area, I am unable to access medicines recommended by the hospital I attend for migraines, as it is not on the formulary for my local CCG. Previously, contraindications or non-effects of medicines has greatly limited my choice. For 3 years, I have been without adequate pain relief. I have now been put forward to a scheme whereby I can access medication that has not yet been licensed, in the hope that the access in form of pain prevention. My mum does not like this process, but I have both migraines and arthritis. My life is blighted by pain. I just want something to help me. I don't understand the formulary system, but I do know that I am not the only one that experiences this. How much does the system affect ourselves and our families? One last thing that I'm going to talk about is PIP. There are many challenges related to PIP I wanted to draw your attention to. If you have DLA or PIP, you are able to access other benefits, including a disability premium such as the one that comes with housing benefit. Not every parent understood that they would have to pay this if they are not getting PIP. A number of mums were hit greatly by this. To lose their DLA and to have to pay additional costs for housing has had consequences amongst their lives, and many going into debt. One was at great risk of losing her home. After a tribunal, they began receiving PIP. Going unnecessarily into debt, living life during this period in severe stress, seizures, illness, sleeplessness. This is not acceptable. In some families, you can go down the process of preparing the PIP forms for one person. Then you begin the cycle that there will be another child, sometimes others. Then the parent forms will need doing. Then the ESA forms come. If the PIP is not successful, you may or may not get it, and you face another cycle without financial support until you have successfully appealed at tribunal. It is a cycle of stress that ensures a disabled person, especially one with epilepsy, will spiral into worsening health problems and even death. For so many reasons, I cannot fathom how the country does not lose out financially upon this abuse-ridden system. Does anyone have any questions?
Right. Well,
after all that.
Thank you, Branwen. That was a great tour de force. It was amazing. And thank you to your mother as well. You've raised so many different issues, and certainly some of the young people we've talked to about education, some have gone to a school for special needs, but others have gone to mainstream schools. And I presume that depends on the choice of the parents and the child, etc. And both seems to be successful in some cases and in other cases not. So that, I think, is a matter of choice. But I think the way you've highlighted the issues in education have been really, really good for us to listen to and to hear. Can I just ask something about families? You were talking about families. And today, and through the oral evidence that we're taking now from patients, you are unique because you are the only person who has been affected, a young person who's come to talk to us about it. So for us that is very, very useful and helpful. Thank you. I just wondered, because I think we've heard from other young people in a more informal setting, their real concern for their parent. And I wonder if you felt that with your mother, because after all she has epilepsy, and you know whether that's another burden that you carry.
It is. Very recently, Mum's health has gotten even worse. She's been having more seizures. For some reason, she's been discharged by the neurologists. Me and her are trying to push the GP into letting her back in to see the neurologist. He's one of the wonderful people who's always listened to me as well as my mum, because he knows what I've seen. He knows that I've seen her almost die. Actually, within the last 5 months, I've probably had to phone an ambulance 3 times for her, which is really heartbreaking, because at one point I genuinely did think she was going to die, because I was only out for about 10 minutes, and when I got back she had the biggest bruise on her face. She could not remember me, she could not remember where she was. Thankfully, this is going to sound ridiculous, but thankfully we have cats, and they were able to comfort her, and somehow she was able to remember where she was, and it took a good 2 or 3 hours until the ambulance came. And that is one of the scariest things, though, is not knowing what's going to happen to your mother or father, saying that, you know. And because we live far away from like my nan, my aunts, my uncles, because they live up west, what's going to happen with us, you know? Because I know I'm going to be fine, but what's going to happen with my sister? Because yes, she is still under adult social care services, but what sort of home will she be put into? Because there's loads of talk of her being put into a I don't know what they're called, it's a block of flats where you're with a load of disabled people, and I have no idea what it's called, but I don't know.
I think we know what you mean.
Yeah.
A supported.
Yes, yeah, that's it, yeah. And me and Mum have been talking about it, and we don't think that she'd ever be able to cope with that sort of thing because of my sister's hearing. If she has any form of different pitch or anything, it caused my sister to have a sort of echoing effect in her brain, and it would take her a while to calm down. And if that sort of thing happens, she'll probably have to phone me to settle her down, and it's just really difficult, to be honest. But yeah, I mean, I don't know what's going to happen. Touch wood, if anything happens to Mum, you know.
I think your courage is amazing, and the way you're coping with all this, and coming here today, which is another added tension perhaps, but certainly that was very, very good indeed. I just asked my colleagues if they would like to ask questions.
Yeah, I just want to say thank you. It's been very interesting and very useful for us. Thank you.
Thank you very much.
Yeah, I'd agree. I mean, it's very enlightening, Branwen. Thank you. As Julia says, you are unique in terms of these hearings, and we met other young people alongside you a few months ago, and that was really valuable as well. But one of the things I was interested in is what you were saying about the benefit system and the PIP in particular. And I think you used the phrase cycle of stress to summarise how it feels, which is probably echoes what other people have told us about having to deal with the benefit system. I just wondered whether you've got any thoughts about, well, how could you make it less stressful? What could the Department of Work and Pensions do for someone in your position to just make it a bit less stressful?
Oh God. Well, I understand that there's literally 2 separate categories. It's care and mobility. The thing is, I understand the care side, but the mobility is just, it's not that it's tight or anything, it's just like, I've tried to fight for it myself, and it's not easy because you literally have to I think, was it walk 200 yards with support or something, and that's what stresses us out, is that it's not as flexible as it was with disability living allowance. With PIP you could either get lower care and higher mobility, or you could get high care and no mobility. And that's what stresses us out, because with the DLA you always got middle rate care and middle rate mobility, and there's always something in between. But with PIP I think it's just higher and lower. I don't think there is an in between.
So they had a bit more flexibility.
Yeah. It really would, to be honest, it really would.
But I understand you also have a healthcare budget, do you?
Yes, yeah.
That doesn't disqualify you for PIP?
I don't think so, no. No.
Right. Well, we've got a colleague who knows a lot about that, so we'll probably ask. Right. Valerie.
No, it's all very informative, and thank you, Branwen. I was interested in your conversation about the education and healthcare plan, and the notion, are you suggesting that if a parent opted for homeschooling, that that child would be disadvantaged by the way the education and healthcare plan operates? In other words, can you get the support if you opt for homeschooling?
Well, like I mentioned, it depends on the council, on the sort of area that you live in. Like I've mentioned, I've met loads of different families.
So some do, some don't.
Yeah. It's hard to tell, and one of the things that the families ask me about is if there is a way that they could possibly get the care plan or the budget and stuff, and I'm just like, you need to fight with your council, because there's nothing I can do, and me and Mum try and help them, but there's so much that we can do when we're just sitting behind a computer,
Might have a look at that.
Yeah.
Do you know people that have gone for a more flexi school approach, so they're not completely homeschooled and they're not completely schooled within school?
Actually, I know of one family. I think the little one was homeschooled, but then they switched her to education, like by teachers and stuff, because I think it was too hard for the mum to do it. But I don't know if there's anyone who's actually split it down the middle.
Okay.
But I don't know if my mum spoke about doing that with me one day, but I don't know if that actually happened, to be honest. But sorry, that's making me think now. But yeah, I don't think there is a down the middle with that one, actually.
I'm sure your mother will watch this.
Yes,
She will help us and also supplement. But you've read it all so clearly, and that's been really, really helpful. So thank you very much.
Thank you.